Hello and welcome. It's been 2 years since the world went into the pandemic era. It's also been a year since we saw that deadly COVID Delta wave hit our country. Almost every one of us lost somebody we knew, somebody we loved, somebody we cared for, we cherished. It was really a nightmare summer last year. 2 years on, today we stare at a situation where our cases are at an extremely low level. We're staring at a situation we're almost going back to normal life, almost. But the virus still exists, which is why it is extremely important for us to not forget that the pandemic is still out there. To learn lessons from what we have gone through to help us prepare better for what may happen next. Welcome to another edition of Simplified with me, Tanvi Shukla. Today we talk about this whole big debate that has been triggered with WHO's latest report and findings on excess deaths due to COVID. Now it's a global report, but one of the biggest talking points has been its findings in terms of how many people died due to COVID in India. Our own government has rejected this report outright. In fact, it has been in conversation with WHO now for several weeks. Even before the final report was published, the Indian government had taken up this issue with WHO. Now, let's first look at why is this such a big story. Because WHO estimates that about 47 lakh 4.7 million people in our country died due to COVID since the pandemic started till end of December 2021. So in 2020 and 2021, we lost 47 lakh lives to COVID. This means that India accounts for almost 22% of the total global excess deaths as of December 31st, 2021. It's the highest number of excess COVID deaths across the world. Now, the government says that the methodology itself that WHO has used to calculate this is not accurate, is not acceptable. The government says that the civil registration system that we have that keeps a record of all births, deaths, conditions and situations under which this has happened, that keeps a record of this in our country, is the one that has authentic data. It has rejected the mathematical model that has been used by WHO to calculate these mortality numbers. It has rejected the fact that WHO used information published in media reports in about 18 states of our country. Why did they do that? Because we don't have a central consolidated data that does factor in the additional excess deaths so far, at least for 2021. So this is where the two entities stand of how they see the information. Today we're going to talk about it. But before we break down the technicalities for you, let's just understand why government's own data that pegs our total deaths as of December 2021 to 1/10 of what WHO is saying, why that may not be accurate. Firstly, and we will talk about this more, 6% rise in civil registration data in deaths in just 2020. That means that we saw 6% more deaths in 2020 than in 2019. Some of it has to be attributed to COVID. Secondly, for the longest time initially, most of the states were not considering deaths due to comorbidities as COVID deaths. Patients who had COVID but died due to a heart attack or some other organ failure were not called a COVID death, and so that never went into our record, and now it's very difficult to go back and change that. Thirdly, if you see even the claims for COVID compensation, many of whom have been approved by governments, they are much higher than what our total COVID death toll suggests. Fourthly, we had the pictures for us, hundreds of bodies seen around the banks of rivers in our country at the peak of the Delta wave last year. And of course, our testing was low, not as high as we would want to be able to catch as many patients as we could. So there may be a lot who went undetected, who died undetected of COVID as a cause. This is just to put some perspective before we fight it out about the actual numbers. Now, also important to know, and our guests will highlight this more, is that it's not just WHO and its findings. The Center for Global Development came out with its own set of studies and findings basis what was already there and said that India may have seen 34 to 47 lakh excess deaths. There was a study that was published, a peer-reviewed study published in Lancet, that said 37 to 43 lakh excess deaths may have occurred in India. There was a survey that was published in the Science that said that India's actual death toll due to COVID was 6 to 7 times higher than what the official data suggested. Economists did another report which said that up until May 2021, at least 23 lakh had died in our country. So let's now decode this better. And I say hello and welcome to Prabhat, Professor of Global Health at St. Michael Hospital and University of Toronto, Rajib Dasgupta, Chairperson for Center of Social Medicine and Community Health at Jawaharlal Nehru University. Thank you both, gentlemen. Before I get into the technicalities, I again want to use your help to emphasize why is it important, why is it so important to know how many people have died? I have had these conversations with people around me who say, well, we all know how bad it was. We all lost somebody. We do know that some deaths went accounted. So why are we fighting over it? Let me actually start off with Prabhat on this.
It's important to count the dead because doing so helps the living. If we've got data on how many deaths have occurred and in which populations, going backwards, we can understand what was the effectiveness of various interventions. And that's true within India and it's true worldwide. The second reason is going forward, if there's going to be future viral waves and there'll be strategies to mitigate those, how will we know they really work? Well, one of the most effective ways is to know whether the death rates stay low. So for those reasons, but I would say there's an important additional reason. We have a moral accountability to all of those that lost a loved one. And you know how traumatic and hurtful this was for millions and millions of Indians, that it is responsible, it is the moral responsibility to give those that died a fair account and not to remain invisible deaths.
Absolutely. Dr. Rajib Dasgupta, would you like to add to that? Dr. Rajib Dasgupta, I think you're on mute.
Sorry. Thank you. And of course, Professor Jha is absolutely bang on. What we need to delve into some of the basics before trying to unravel the intricacies is that this report is talking about excess mortality and not actual COVID deaths. That's the first thing. Now, the term excess mortality is used in epidemiology and public health, and this refers to the number of deaths from all causes. That's extremely important. The operative word is all causes during a crisis beyond what we would have otherwise expected in normal times. So the emphasis is on all causes, the emphasis is on crisis. And finally, this can only be an estimate and this can never be an actual number. If we can get these three basics right, then I hope we can sift the heat from the light. There is unfortunately too much heat. We need to bring back the light into the debate, into the discussion, into the discourse.
So let me ask you this. On one hand, we have the government official data on saying that about 5 lakh people have died due to COVID in our country. On the other hand, a lot of these reports, like you said, there's a difference between COVID deaths and the excess mortality that many of these reports have worked on, that they peg the number way above 35 lakh, almost 45 to 47 lakh, 6 to 10 times. Where do you think the reality really lies about our actual COVID death toll then?
Well, if I were to give a more direct answer about the reality, let us remember that for each of the parameters, whether it's by age, by sex, by month, WHO estimates give an upper bound and a lower bound. What much of the debate, and if not the quibbling, is about the mean value. Now, even if it were closer to the lower bound, which certainly the government of India claims, and certainly all of us would like to be, it would still be within that range, and therefore fairly correct, given that it's within the range. How do we argue it? the government of India can certainly have a case in arguing it on the basis of the 2020 CRS data that's available. But again, remember, those are actual numbers, whereas this is a model which has layers of intricacies built into it to capture the big picture of excess mortality.
Mr. Prabhat, you of course did your own study as well that did peg the number a lot higher than what the government's official data is. You also worked, as a technical advisor on how to formulate mathematical models that will help us get closer to reality. So help us understand why you believe the number that WHO has given us is perhaps closer to reality than our government.
It's important to understand what the WHO did. And first of all, I was not involved in writing the report. I'm a member of the technical advisory group that reviewed it, but I was not involved in writing it. The method looks at excess deaths. And remember, the comparison of excess deaths is not deaths versus a zero baseline. It compares historic data for the same time periods and says, well, if a certain number of deaths were expected, let's say in May of 2021, how many actual deaths were reported? And the difference is the excess deaths. In a pandemic situation, during the weeks where basically there's uncontrolled transmission, almost all of the excess deaths will be COVID deaths. That just follows. Why would things go up so much? Now, it is true that some causes, like untreated heart attack, that weren't treated in hospital would have gone up because the hospitals were flooded. But that's a consequence of the COVID pandemic, and it's fair to include it in the excess. But it's also true that some causes would have gone down, like traffic injuries. So the WHO method has taken this to account. I think it's important not to simply dismiss this as a mathematical model. This is not something that's just drawn from data outside. The WHO took the actual state reports published on state websites and through RTI acts by journalists obtained for 17 states and put that together. And they've extrapolated it to the rest of India with minor assumptions in the model. That's basically the assumption here. This is not a model, as the Indian government first claimed, that uses data from small countries and extrapolates it to India. No. The way to think about this is the model has used reasonably simple estimates. And we all know if it's raining in Delhi, chances are it's raining in Lucknow. That's the way to think about it. And that's the level of assumptions that have been built into the model. The last point I would make before ceding the floor to you is the Indian government's press release in defense of their estimates actually corroborate the WHO's. And let me explain to you how. They reported in the civil registration system, which is far from complete. They say it's 92% complete, but other independent investigators have said it's perhaps 70 to 80% complete. The National Family Health Survey found only 70+% of deaths were actually registered. So you can't say 92% coverage when other sources say that it's far less coverage. But let's take the civil registration data as its own. So in 2020, the civil registration reported 8.1 million deaths, 8 lakh basically. And I'll just stick to million. I always get the two confused.
Yes,
8.1 million. 8.1 million deaths. If you look at the average of 2018 and 19 deaths, and it's not good to just use one data, that's cherry picking. Look at the average. And in fact, if you should use average of earlier years, the average of 2018-19 was 7.3 million deaths. So the difference is 0.8 million from the from the Indian government's own data, which is 11% excess versus the earlier years. What is WHO's estimate for 2020? It's 0.8 million or 9% excess. What is our estimate based upon the National Sea Voter Poll, which is a random sample of polls over the whole of India? Well, we only surveyed about 8 months of data for 2020, and that showed 0.6 million excess, or 9%. So Indian government 11%, WHO 9%, us 9%. The Indian government has corroborated the WHO findings for 2020 with its own data.
Since you mentioned that point, and that has been given as an argument by both sides in different with different interpretations, I just want to pull out the historical data, not just from the deaths that we have from 2019 to 2020, but I was looking at the information that was even for the preceding 2 years. So, for example, in 2018, we reported 4.8 lakh additional deaths in 2017. In 2019, that number actually went up, and we reported 6.9 lakh additional deaths from 2018. And in 2020 is the number that you were referring to, for about 4.8 lakh additional deaths. The government claims we're actually seeing these excess deaths, and you cannot label them just as COVID deaths. Maybe it's more about, as the government says, better reporting. Better recording of deaths and giving all those certificates, because if you actually see 2018, 2019, 2020, then there is no anomaly here. What would you say to that, Prabhat?
You want the civil registration coverage in India is still very poor on the whole. About 10 million deaths, 1 crore deaths occur in India, according to the UN and WHO and most demographers and our estimates as well. Of those, 3 million up until 2018 were simply not registered, and 8 million did not have a medically certified death certificate. So this is the background. And if you go to poor states, it's worse. If you go to UP, Bihar, it's even worse. So the civil registration data that are being reported have not substantially improved. They've improved slowly, but they haven't improved substantially. So what was going on in 2018-19 that people suddenly started reporting deaths more? Well, there's very little to think so. Now, there are year-to-year fluctuations because you have some changes in the death rates. You also have some changes in the population, and you have changes in registration. So this is all the more reason, if you're comparing the same data, then use the average of a few years to smooth out those fluctuations. And if you do that, there's unambiguous, perhaps 11%, maybe it's a bit smaller, increase in 2020 deaths versus earlier. And that's exactly or very similar to the WHO's estimates and to our estimates. So the 2020 estimates for WHO seem to be right. Are they right for 2021? Well, the Indian government should release the 2021 data as soon as possible. And moreover, there's a very simple way, or two simple ways that this could be dealt with. The civil registration data could release data by month or week. So if there's an excess, it should be concentrated in certain weeks. And so that's the question, was those 8.8 million, 8 lakh excess deaths, are they concentrated in the COVID months? If they are, they're more likely to be COVID. If they're not, then they're not COVID. The other important thing, which going forward would be very simple, in September of this year, the Registrar General will launch the national census. To that, they could add a really simple question. Was there a death in this house in 2020, 2021, 2022? And if so, what was the age, sex, and date? You don't even know if it was COVID or not, but a simple question like that, if you look then at the weekly graphs, compare them to the pandemic curves from the testing, India would have a direct answer of how many people were killed. So I hope the Indian government will actually take this up to resolve the controversy. And last point I would make is, of course, all methodologies have limitations for each study, including our own. But of the 14 studies so far that have been done using a variety of methods, all have found an undercount between at least 4 up to 10-fold. And Professor Dasgupta is right that the way to think about the WHO estimate is even the lower estimate of 3.3 million. Is that credible? Well, we think it is.
Yes, yes, 14 different studies. And so just to outright reject, a larger one conducted by the World Health Organization, to me doesn't sound very prudent. There needs to be at least an intent to try and find the truth and give people the truth. In fact, let me just add to one other instance where the government seems to be, a little confusing us in when they stand with the WHO and when they don't. The government cited the same WHO's data on mortality rate last year when it was trying to again reject the total death numbers in our country. And this was at the peak of the second wave, the peak of the Delta wave, where there was so much reportage that was happening across states about the actual death figures being way higher than what the states were admitting. And the government at that point had said, no, we can't get carried away by these news reports, by these local reports. They are not verified. They're not going about it the right way. Same argument that has been given this time. But they did say, look at the mortality rate that WHO has put out. India is far better than United States, than Brazil, Mexico, Russia. That aspect still stands true, even in the latest data that the WHO has come out. That aspect, Mr. Rajib Dasgupta, stands true. India's mortality rate, if you calculate, is much better than a lot of other countries. We obviously we have a much higher number simply because of our population is so big. So why is it that we are choosing to accept statistics that make us look good, but not the other side?
Now, to extend the case being made by Professor Jha, now that the CRS 2020 is available, it actually validates the case. However, to add to what he said, remember that birth registration actually fell by 2.5%. And that's across the country. In a well-functioning registration system like Andhra Pradesh, birth registration fell by 6.5%. That shows the strain that the registration system was under, just like all other systems were under a strain. And therefore, even that 5 lakh excess death of 2020 by the CRS against roughly the 1.5 lakh official figure that India has is actually likely to be a bit higher than even 5 lakhs or so. And that would actually converge with more or less the excess death coming from the WHO estimates. Now, as far as Southeast Asia as a whole goes, and that holds for India certainly, bulk of the excess death is in 2021, which is when the Delta wave hit us very badly. And that case can only be made this way or the other when the CRS 2021 is available. In contrast, most of the excess deaths in the Americas and the Europe, the two WHO regions, are actually in 2020. And therefore, 2020 seems sort of comfortable for India because most of the excess deaths come in 2021 when the Delta hit us very badly across the country, very vast populations. And therefore, that remains really the worrisome point. 2020 is, I believe, and in fact, that's what also Dr. Jha is saying, is more or less a settled case.
Well, thank you so much, gentlemen. I think that's been an extremely insightful conversation and it's helped us, really put the entire issue in perspective. So I'm going to thank both of our experts for joining me on this edition of Simplified and breaking down, the complexities of this report and how it should be interpreted. Let's just quickly summarize this. The fact of the matter is that the WHO findings puts excess deaths at 4.7 million, at 47 lakh, for a time period where our country government said that the total deaths were about 4.8 lakh. So 47 lakh, 4.8 lakh. That's the difference we are talking about, hence 10 times. But as our experts explained to you, if you really see the breakdown for 2020, the numbers largely match with even what our civil registration system is showing us. So what the civil registration system that released the data, the deaths data for our country for 2020 is indicating is largely what even the WHO finding has said. Now the civil registration data has just released the information for 2020. It's nowhere close to telling us how many people died in this country of all causes and then different causes for 2021. And that's where perhaps the larger disconnect would lie with what the Indian government's official record says, what CRS may tell us at one point, and the WHO is already telling us. But remember, experts pointing out, and I gave you examples of 4 of those reports, there are at least 14 different studies, surveys that have been conducted basis the available information that indicate that India's COVID death count may be at least 4 to 10 times higher than what the official records are telling us. And this cannot just be dismissed or outright simply because we need to know the reality. If we don't know just how well or badly we performed in saving lives when the pandemic was at its peak, at its worst, when certain things could have gone unreported but were still affecting us, still breaking homes, still breaking businesses, still taking away lives. If we don't know that truth, we will never be able to prepare better for what comes next. Experts will tell you that coronavirus hasn't gone away, it is still there. This pandemic isn't really over. It will also perhaps not be the last pandemic. So we need to find, and our government needs to find, an effective, credible way of finding the truth, the actual data. We need to work on collating data. There have been international examples when the world mortality data set was being created where our government said the data is not available. When this was being debated in the parliament, the central government said the state governments isn't giving us additional data. When the Supreme Court was hearing the case about COVID compensation for families who had lost somebody, we were again staring at a situation that there wasn't credible data on what had gone on. This isn't an acceptable situation, and the government needs to find how they can make it better rather than dismissing any third-party report that comes that may not be to their liking. Thank you so much for joining us on this edition of Simplified.